There appears to be some confusion about who knew what and when before the governor announced a lifting of restrictions here in Texas. Hello, everybody. I'm Heather Hayes.
And I'm Steve Eager. It's 9 o'clock. Several of the governor's health advisors say they weren't consulted before the announcement, and one objects to the governor's decision. The governor worked to clear some of that up today when we asked his office about it. He also responded to criticism coming from the White House. Fox 4's Blake Hansen breaks it all down tonight. Blake.
Stephen, Heather, many health experts who have reacted to the governor's decision have said that this move is too soon, though some admit that it's too hard to say whether there's going to be a real big impact or not. What is clear is that some of the governor's advisors that he picked to advise him on COVID-19 weren't looped in.
Texas, I think it's a big mistake.
President Joe Biden at the White House Wednesday chastised Governor Abbott over the decision to lift the mask mandate, saying we're close to the finish line.
The last thing we need is the Neanderthal thinking that in the meantime everything's fine, take off your mask, forget it. It still matters.
In response, Governor Abbott today said recoveries, reduced hospitalizations, and vaccinations brought him to his decision. And in a tweet, he criticized President Biden's immigration policies, linking them to the spread of COVID-19. And while Governor Abbott defended his decisions, we're learning he didn't directly consult at least 3 of his 4 chief medical advisors on his COVID-19 strike force. Dr. Parker Hudson with the Dell Medical School tweeted Wednesday, "Many are asking, I was not consulted prior to the governor's order." Dr. Mark McClellan with Duke University told me he wasn't consulted either. He told me by email, "I don't think this is the right time. Texas has been making some real progress, but it's too soon for full reopening and to stop masking around others." State Health Services Commissioner Dr. John Hellerstedt was asked if the governor talked with him during a virtual appearance before the Texas House Public Health Committee.
Was that conversation prior to the governor's announcement yesterday?
I have had conversations with his team prior to the announcement.
Okay. But not your personal conversation with him?
No, I did not have a personal conversation with him prior to the decision.
The governor's office didn't push back, instead saying in a vague statement, the governor speaks regularly with Dr. Hellerstedt and Dr. Zerwas, along with others in the medical community, regarding yesterday's announcement. All were in agreement that Texas should continue following medical advice and safe standards on preventing COVID-19.
Personally, I think from some perspective, it feels a little bit premature.
Steve Miff is with the Parkland Center for Clinical Innovation. He does not project the policy change will significantly impact when Texas achieves herd immunity, likely in mid-June.
To me, the latest policy announcements and developments, while a bit surprising, are not anticipated to significantly change the herd immunity projections at this time. And infections will likely accelerate in some areas within certain demographics. So if anything, we might get to herd immunity faster. But getting there through people being infected is not safe for anybody.
The governor's order will not prevent businesses from requiring masks, and many will require them. Veronica Bradley opened Vector Brewing in Dallas during the pandemic.
No, there is nobody in the entire world that wants to operate at 100% without masks on more than me.
Bradley says until the CDC says it's safe, they'll keep requiring masks and cap occupancy, even though they know not everyone will be happy.
We weren't really planning on changing that anytime soon. We wanted to have at least one person on our staff vaccinated first. So when we heard that everything was just changing pretty quickly, we got very nervous because there's no right answer and there's no right thing to do because we're going to make customers angry.
We've also seen a lot of businesses coming out today and saying that they're going to require their employees or their vendors to wear masks, but maybe not do that for customers. Some are encouraging and others just kind of leaving it up to those customers. Keep in mind, some have expressed concern that retail workers, people like grocery stores, restaurants, other places, may be put in a tough position if they are the ones that are telling people to wear masks when it's not something that is mandated by state law, even though businesses can require it.